Thank you, Presiding Officer. Minister, one of the greatest inequalities in cancer care is the revelation that we are not collecting data on the ethnicity of cancer patients. Many might say, why does that matter? It is just data. But when it comes to the treatment, that data is vital. How do we know that treatments developed for white Northern Europeans are effective in treating cancers in patients of African or Indo-Asian descent? Assumptions are being made about how patients will respond, despite there being clear differences in how certain cancers affect different racial groups. Minister, what steps are the Welsh Government taking to ensure ethnicity data is included in all patient records, particularly as we move towards personalized medicine?
Thanks very much. And I was very interested to read some of the findings of the cross-party group on cancer and on the inequalities of cancer. And certainly data is absolutely key. That's certainly something that we're always trying to improve, how we manage our data, how we monitor our data, and ethnicity is something certainly we'll need to consider. What interests me as we get into this new, more individualised response to how we deal with cancer, so responding to the particular cancer in that particular individual, you know, we're right on the threshold of something very, very different, I think, in terms of the way we deal with cancer in future. I read recently, for example, that the way that some people respond to chemotherapy changes due to the kind of different biomes in their stomach. So, you know, everybody's got a different biome. So, you know, this individualised approach will be developing in future years. And obviously, ethnicity, all of those kinds of things, hopefully, will be a consideration when we move to the next phase of how we deal with cancer. And let's not forget that this is all going to be very challenging. You know the financial situation we're in. We know that 1 in 2 people develop cancer, and that as people get older, their chances of getting cancer is going to increase. So none of this is going to be cheap. So we have some really serious challenges ahead of us.